We're inside Al-Aqsa hospital at the emergency department here, and as you can see, it's overcrowded. I'm joined by Doctor Bushra Othman inside the hospital. She's from Panzima Medical Mission, volunteering to help people and medical staff inside the hospital. Dr. Bushra, we need to know more about what's going on inside the emergency department.
Thank you, Hani. So as you can see here, there's extreme overcrowding in the emergency department. This is actually a time when it's not really as busy as it could get, especially when there are attacks nearby. There's limited resources in the department with only a few doctors servicing hundreds of patients. Family members are everywhere. There's not enough beds for the patients. You can see them either in wheelchairs or on the floor on mats surrounded by their family members. There are only 3 doctors generally in the emergency department, so these doctors are overworked and understaffed. As you can see here, some of the nurses are helping distribute some of the medications to the patients. There's certainly not enough medications to go round. Some of the antibiotics that we want to use that are crucial aren't available here and also aren't allowed to be let in terms of medical supplies. So it's a hospital, but it's barely functioning and it's working on very limited resources, which is causing a lot of strain. Any minute now, the healthcare system is going to imminently collapse, and the millions of people getting care here at Al-Aqsa Hospital won't be able to get it. This is a hospital normally that would have a couple of hundred beds and doesn't necessarily get to treat a lot of patients. There are now up to 800 patients and thousands of displaced people living here. As you can see all around us, there are patients and their family members in the corridors, in hallways, living with their blankets, family members. It makes it very difficult to be able to move around, even to be able to actually even find your patients. But a lot of times, unfortunately, because there's no structure and there's no system, you actually don't know always where your patients end up or where you might be able to find them in order to provide the treatment that they require. We're in the Pediatric ward, or the children's ward here, which houses infants and small babies all the way up to kids about 12 years old. As you can see, it's extremely overcrowded. One of the striking features that the particularly young babies and infants require is formula and feeding. There's severe malnutrition, especially through both the children and the adult population. As you can see, there's no room for these patients to be in beds. They're surrounded by their family members in the hallways. It's very difficult to be able to examine them with privacy. So unfortunately, sometimes we're having to examine patients and speak to them in open hallways, and that's just become an accepted part of how we can provide care here for them. This war on children is absolutely heartbreaking and soul-shattering. It's very, very difficult to actually provide them any care. So some of these children don't actually have their mother or their father, or potentially both parents. They're here being looked after by extended family members. A lot of them have had shrapnel injuries that are going to leave them with amputations and debilitating problems for the rest of their lives. Now we're walking from the older building to the building that used to be the obstetrics ward that's now been converted to the operating theatres building. And we're going to take a look inside on the limited resources that are being provided here in the operating theatres. In all the healthcare facilities in Gaza, there are only a couple of hospitals that are still partially functional, and this will be one of them.
We just entered the operating theater complex here at the Al-Aqsa Hospital. Dr. Bushra, tell us more what we're seeing here.
Yeah, so just very quickly, on my left-hand side here are the recovery rooms where patients come after they have finished their operations. We can't necessarily show you everything that's inside, but there's very limited resources. There's not necessarily the equipment to be able to monitor them in terms of taking their vital signs like blood pressure and heart rate. There's one main corridor that is both the entryway and the exit for patients coming into the operating rooms, and most of the time there are 4, 5, 6, even up to 10 patients just lining the corridor, and it's very difficult to actually move around.
What are we seeing here? What is this case?
Yeah, so this is a young kid that's obviously had severe burns from an explosion or a blast injury. This is a very common and unfortunate scenario. A lot of these kids are in severe pain because of their wounds. There isn't enough adequate analgesia to be able to give them. They have to come daily down to the operating room to get dressing changes because there isn't enough adequate supply on the wards to be able to dress their wounds appropriately. And they require care actually that sometimes is unnecessarily not able to be provided here at Al-Aqsa Hospital.
Tragedies find you at every corner of Al-Aqsa hospital. After walking into the different departments of this healthcare facility, the only remaining semi-operational healthcare facility in the central area, we couldn't help but noticing the inadequacy of the medical care available for people. This is Hani Mahmoud from Al-Aqsa Hospital in the central area, Gaza, Palestine.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.